Good afternoon, everybody. Welcome. Thanks for joining us today. It is March 18th, and we are in the Health and Social Services Subcommittee of Appropriations here for our Budget Decisions Day. Just a broad announcement at the top. The Developmental Disabilities Administration budget will be worked on in full committee, right? Nope, excuse me, I'm incorrect already. Only the additional pages. So we do only the ads. So okay, so we do have some DDA we're working on here as well in subcommittee. Forgive me, I should have asked for more clarification at the start. Okay, so we will begin, and I will turn to our analyst, Victoria Martinez, our analysts, who will join us at the table to walk us through the document, and then we will do our motions. For subcommittee members, we will be making a motion and a second by me and the subcommittee vice chair on each of the items that we discuss. If there are objections by any individual members, please note as we move through. At the conclusion, we will move to adopt the entire subcommittee report. Okay? All right, so let's begin.
Thank you, Chair Shetty. So you all have two documents in front of you. You have a white packet that's the main decision document, and then you have a blue packet that's additional pages for your consideration. So we're going to be going in page order where the analysts will describe each of the recommendations. Just a quick note about BRFA items. Those will be handled in the full committee, so those aren't included here. So we can go ahead and get started on page 1.
Okay. Beginning with the Office of the Deaf and Hard of Hearing. Item 1 is to delete a vacant position and associated funding. The agency disagrees, considering all positions critical, and the Senate adopted. Item 2 is to adopt committee narrative, requesting updates on state sign language interpreter licensing requirements. The agency concurred, and the Senate rejected.
Second.
Item 3 on page 2, an additional first house action was to restrict $50,000 until the Office of the Deaf and Hard of Hearing publishes notification on the state sign language licensing requirements.
Move to reject.
Second.
Item 4 on page 3, the additional first house action was to restrict $50,000 until the Office of the Deaf and Hard of Hearing submits a report on vacancies. If you turn to page 1 of the blue packet, there is a modification of that to remove the fund restriction and instead turn that to committee narrative.
Move to adopt.
Second.
On page 5, for the Department of Disabilities, DLS recommends concurring with the governor's allowance, and the agency concurred, and the Senate adopted.
Move to concur.
Second.
On page 6 in the Department of Aging, the first recommendation is to reduce funds to increase the turnover expectancy. The agency concurred in part. They concurred with the reduction in federal funds, but not general funds. The first house did modify this action. On that same page, you'll see that the first house only reduced federal funds.
Move to concur. Second.
On page 7, the second recommendation was to adopt a narrative on requesting a report on the implementation of the Supporting Older Adults with Resources program. The agency concurred, and the first house adopted.
Move to concur.
Second.
On page 8, recommendation 3 was to adopt narrative requesting that the agency establish managing for results performance measures for the SOAR program. The agency concurred, and the Senate adopted.
Move to concur.
Second.
There's also 2 additional pages in the blue packet for your consideration. On page 2 of the blue packet, this language restricts funds within the naturally occurring retirement communities program to be used only to distribute grants for specified recipients and uses.
Move to adopt.
Second.
Turning to page 10 of the white packet for the mayor.
Excuse us.
Sorry, one more.
Oh, sorry.
On page 3, this item is narrative requesting a report on senior care facility conditions.
Move to adopt.
Second.
Apologies. Turning to page 10 of the white packet for the Maryland Commission on Civil Rights. Item 1 is to adopt narrative requesting information on measures implemented to reduce case backlogs. If you turn to the blue packet on page 4, there is a modification to add a line of discussion on how the commission determines classification of new positions.
Move to adopt the additional page modification.
Second.
On page 11, in the Maryland Institute for Emergency Medical Services Systems, DLS recommended concurring with the governor's allowance. The agency concurred and the Senate adopted.
Move to concur.
Second.
On page 12, in the Maryland Health Benefit Exchange, the recommendation was to adopt narrative requesting a report on the reinsurance and state subsidy program cost and forecast. The agency did not respond, and the first House adopted.
Move to concur.
Second.
On page 13, in the Maryland Department of Health Administration, DLS recommended adopting committee narrative requesting a report on staffing at state hospital facilities. The agency concurred and the Senate adopted.
Move to concur.
Second.
On page 14, the Senate added language restricting funding pending the receipt of a report on staffing at the John L. Gildner RICA facility.
Move to concur.
Second.
On page 16, the Senate added additional language restricting funds pending the submission of a report on the placement of patients that are found not criminally responsible or incompetent to stand trial.
Move to concur.
Second.
On page 19, in the Office of Healthcare Quality, the DLS recommendation was to concur with the governor's allowance, and the agency concurred. However, the first House adopted 2 additional actions. So listed as number 2 on page 19, the Senate adopted language restricting funds pending the submission of a report on the long-term care program complaint investigation backlog.
Move to concur.
Second.
On page 20, item number 3, the Senate adopted language restricting funds pending the submission of a report with details on a memorandum of understanding with Montgomery County for nursing home survey activities.
Move to concur.
Second.
On page 22, in the health professional boards and commissions, the first recommendation was to adopt narrative requesting that the Managing for Results performance measure include the total licenses and complaint rate for the Board of Nursing, and the agency concurred and the Senate adopted.
Move to concur.
Second.
The second recommendation was to adopt narrative requesting a report with an update on the Board of Professional Counselors and Therapists evaluation recommendation activities. However, the agency concurred. However, if you turn to the next item on page 24, the Senate adopted language modifying the DLS recommendation to be language restricting funds instead of narrative.
Move to concur.
Second.
On page 26, the Senate adopted a language requesting a report on the impact of fund balance transfers on the boards.
Move to concur.
Second.
On page 27, the Senate adopted language restricting funds pending the submission of a letter confirming the submission of regulations related to prescription labels.
Move to concur.
Second.
On page 30, in the Public Health Administration, DLS recommended concurring with the governor's allowance. The agency concurred and the Senate adopted.
Move to concur.
Second.
On page 31, in the Prevention and Health Promotion Administration, DLS recommended amending budget bill language to align with a BRFA provision that would reduce the funding mandate for tobacco use reduction activities, as well as increase the amount of the contingent reduction to meet that mandate. The agency concurred and the Senate adopted.
Move to concur.
Second.
The Senate added an additional piece of language, number 2, starting on page 31, that restricts funds pending the submission of a report on screening and treatment of serious health conditions in children.
Move to concur.
Second.
Turning to the Behavioral Health Administration, beginning on page 34, recommendation 1 was to reduce funding to reflect a higher assumed vacancy rate in fiscal 2027. The agency disagreed, stating that they needed the funds to fill their vacant positions, and the Senate rejected the DLS recommendation.
Move to concur.
Second.
There are 4 pieces of annual language, number recommendations 2, 3, 5, and 9, which I can point out as we move along. This language restricts funding to the 3 BHA programs and 1 provider reimbursement program in Medicaid. The agency concurred with all 4, and the Senate adopted all 4.
What page are we on? 2, 3, 5, and 9, so
Starting with 2, and then I can point out when we get to
2
that.
is on 34.
Okay, thank you. Move
Yeah.
to concur.
Second.
On page 35, number 3 is another piece of that annual language that you've just adopted. Number 4, beginning on the bottom of page 35, restricts funds pending the submission of the status of corrective actions related to repeat audit findings. The agency concurred, the Senate adopted.
Move to concur.
Second.
Recommendation 5 is another piece of annual language. Number 6, starting on the bottom of page 37, restricts funds pending the submission of fiscal 28 budget data with provider reimbursements in the community services program budgeted separately. The agency concurred but requested that funding not be restricted. The Senate adopted the DLS recommendation.
Move to concur.
Second.
Recommendation 7 on page 39 restricts funds pending the submission of non-Medicaid provider reimbursement data. The agency concurred and the Senate adopted.
Move to concur.
Second.
Recommendation 8, starting on page 40, restricts funds pending the submission of the timeliness of grants to local nonprofit core service agencies. The agency concurred in part but requested a later due date, and the Senate modified to extend the due date, which is included in the first House modification on pages 42 through 44.
Move to concur.
Second.
Recommendation 9 is another, the final piece of the annual language that we discussed earlier. Recommendation 10 on page 45 is to adopt committee narrative requesting a report on the transition to the new administrative services organization. The agency concurred. The Senate instead rejected and instead adopted language to restrict funds pending the submission of this report, which is included on pages 52 and 53 of this packet.
52 and 53.
So the content of the report is the same, but the Senate has adopted language that would restrict $100,000 until the report is submitted.
Move to concur.
Second.
Turning back to page 47, recommendation 11 is to adopt committee narrative requesting a report on reimbursable fund spending in the behavioral health Medicaid program. The agency concurred but requested a later due date for the report, and the Senate modified to extend the due date, which is included just below this on page 48 through 49.
Move to concur.
Second.
On page 49, the Senate also added language that restricted $1 million in the Behavioral Health Administration Community Services Program for certification fees and internship costs for peer recovery specialists.
Move to concur.
Second.
On pages 50 through 52, the Senate also added language restricting funds pending the submission of a report on MDH's efforts to improve the behavioral health workforce.
Move to concur.
Second.
On pages 52 and 53, apologies, that is what the Senate modification that you adopted. The final action is on page 54 through 55. The Senate adopted committee narrative requesting a report on financing options for long-acting injectable medication.
Move to concur.
Second.
On page 56 in the Developmental Disabilities Administration, the first recommendation is to add language restricting funds pending quarterly reports on community services spending, the agency concurred but requested the deadlines be extended by 2 weeks. So if you turn to page 58, the Senate adopted the language with the delayed due dates. However, I do have an additional page for your consideration on page 5 of the blue packet. This additional page modifies the language adopted by the Senate to require monthly reporting and specify additional data to be included.
Move to adopt the additional page modification.
Second.
On page 60, the second recommendation was to add a language restricting funds pending a report on LTSS service utilization trends. The agency concurred and the Senate adopted.
Move to concur.
Second.
On page 62, the DLS recommendation was to add language restricting funds pending a report on the implementation of fiscal 2027 cost containment actions. The agency did not respond, and if you turn to the bottom of page 63, the first House modified this language to specify the cost containment actions that should be included in the report.
Move to concur.
Second.
On page 66, recommendation 4 is annual language restricting funds in the community services program to that purpose only. The agency did not respond, and the Senate adopted.
Move to concur.
Second.
On that same page, recommendation 5 is to adopt a narrative requesting a report on person-centered plan review processing times. The agency concurred and the Senate adopted.
Move to concur.
Second.
I just want to take a minute to note how important that piece is to our subcommittee. There are so many pieces of the Developmental Disabilities Administration budget that we've been tracking, but I know that many of us have heard specifically feedback from constituents around this specific issue. So I just want to thank the subcommittee for your support of this particular provision. Thank you.
On page 68, the Senate adopted language specifying the policy that DDA shall use to guide the enforcement of a cost containment action related to dedicated hours.
Move to concur.
Second.
I also have 2 additional pages for your consideration back in the blue packet. On page 7, this language specifies the implementation of certain cost containment actions regarding rate reductions and individuals funded with state-only funded services.
Move to adopt.
On page 8 of the blue packet, this language specifies the implementation of day-to-day administrative supports for participants in the self-directed services model.
Move to adopt.
Second.
Okay, turning back to the decision document, page 71 begins items related to Medicaid. The first item, DLS recommends reducing $8 million in anticipation of patients with end-stage renal disease being covered under Medicare. MDH disagreed due to the timing of outreach implementation. The Senate adopted the reduction.
Move to concur.
Second.
Again, I just want to point out that this actually came from report language that we were able to get in this year's budget from the Medicaid program around what this could mean if we were able to benefit. So this additional potential savings to our budget and better outcomes for patients are coming because this committee took action last year. So thank you again.
Item 2 on the bottom of page 71, this would add language making $8 million contingent, or special funds contingent on an action in the BRFA. The agency concurred, the Senate adopted.
Move to concur.
Second.
On page 72, items 3 and 4 are both annual language that would restrict funds in Medicaid and the Maryland Children's Health Program to that purpose, or allow some transfer between Medicaid programs. The Senate adopted both.
Move to concur to both.
Second.
On page 73, item 5, DLS recommends restricting funds pending a report on Community First Choice Program and Community Options Waiver spending. The Senate modified this language, and so if you turn to the bottom of page 75, you can see that the fund restriction was made $250,000, and then additional information requests were added on the eligibility determination division.
Move to concur.
Second.
So then turning to page 78, item 6 is language that would restrict funds pending a letter from OLA on the resolution of corrective actions on the most recent audit the Senate adopted.
Move to concur.
Second.
On page 79, item 8, this is a technical correction that would change contingent language to better match the BRFA provision. The agency concurred, the Senate adopted.
Move to concur.
Second.
On page 80, item 9, this is a recommendation for narrative that requests information on One Big Beautiful Bill Act implementation. MDH concurred, the Senate adopted.
Move to concur.
Second.
Turning to page 82, item 10 is a recommendation to reduce $10 million in general funds, $70 million in total funds due to prior year claims spending being less than expected so far this year. The agency disagreed and the Senate adopted.
Move to concur.
Second.
And then on page 83, item 11, this would be a reduction of 44.2 million general funds, 151 million in total funds. This is to recognize the medical loss ratio recoveries. The agency disagreed, the Senate adopted.
Move to concur.
Second.
If you turn to page 9 of the blue packet, there's an additional item for your consideration. This is narrative that would request a report on prescription drug reimbursement in fee-for-service and by managed care organizations.
Move to adopt.
Second.
Turning back to the decision document. So then, beginning on page 84, this is for the Health Regulatory Commissions. The first item is also technical and would adjust contingent language to better match the BRFA provision that it relates to. The agency concurred, the Senate adopted.
Move to concur.
Second.
Item 2 on page 84, this is a recommendation for narrative requesting report on primary care programs and initiatives under the AHEAD model. The agency concurred, the Senate adopted.
Move to concur.
Second.
Then on page 85, item 3, this is language that would restrict $100,000 for information on market stabilization of the Medicare Advantage market that the Senate adopted.
Move to modify to increase restriction to 250,000.
Second.
Oh, sorry. Delegate Ross, thank you. Approved.
And then on page 88, the Senate adopted narrative that requests a report on temporary staffing contracts in hospitals.
Move to concur.
Second.
Turning to page 89 for DHS administration, item 1 is a recommendation to reduce the fiscal 27 appropriation for CJAMS and CSMS by about $5.5 million. The agency disagrees and the Senate adopted.
Move to reject.
Second.
Item 2 is to add language restricting $750,000 until DHS submits information on the fiscal 2026 closeout information. The agency concurred and the Senate adopted.
Move to concur.
Second.
Item 3 on page 91 is to add language reducing $6.8 million for the Constituent Services Call Center. The agency disagrees and the Senate adopted.
Move to reject.
Second.
On page 92, item 4 is a recommendation to add language to reduce the special fund appropriation deficiency for the call center services. The agency disagrees and the Senate adopted.
Move to reject.
Second.
On page 93 for the Social Services Administration, the first recommendation is to add language restricting funds for child welfare services to that purpose only. The agency concurred and the Senate adopted.
Move to concur.
Second.
The second recommendation on that same page restricts funds for foster care program to that purpose only. The agency concurred and the Senate adopted.
Move to concur.
Second.
Recommendation 3 on page 94 adds language restricting funds pending the submission of a report on child welfare workforce. The agency concurred in part and the Senate adopted.
Move to concur.
Second.
On page 96, recommendation number 4 restricts funds pending a report on youth placed in hospitals, hotels, and other unlicensed settings. The agency concurred in part and the Senate adopted.
Move to concur.
Second.
On page 99, recommendation 5 restricts funds pending the resolution of repeat audit findings. The agency concurred and the Senate adopted.
Move to concur.
Second.
On page 100, recommendation 6 restricts funds pending a report on costs associated with placing youth in hotels. The agency concurred in part and the Senate adopted.
Move to concur.
Second.
Recommendation 7, beginning at the bottom of page 101 and continuing on to the next couple pages. This restricts funds pending the submission of a letter confirming that the department has uploaded child welfare services data to their website. The agency concurred and the first house adopted.
Move to concur.
Second.
Recommendation 8 on page 104 restricts funds pending the submission of a letter confirming they've submitted Medicaid state plan amendment. The agency disagreed. The Senate increased the amount restricted to a total of $400,000. That's seen on page 105.
Move to concur.
Second.
Beginning at the bottom of page 106, recommendation 9 is to adopt a narrative requesting a report on the implementation of provisions of the Family First Prevention Services Act. The agency concurred and the first house adopted.
Move to concur.
Second.
On page 108, recommendation 10 is narrative requesting a report on child fatalities. The agency concurred and the first house adopted.
Move to concur.
Second.
On page 109, there's an additional first house action. The Senate adopted language restricting funds pending the submission of a report on pediatric hospital overstays.
Very much move to concur.
Second.
On page 110, recommendation 12 restricts funds in the deficiency appropriation for foster care program to that purpose only. The agency disagreed and the Senate adopted.
Move to concur.
Second.
On page 112 for DHS Child Support Administration, item 1 is a recommendation to reduce funds for non-custodial parent employment and training contracts. The agency disagrees and the Senate adopted.
Move to reject.
Second.
Item 2, beginning at the bottom of that page, is to adopt committee narrative requesting child support performance reports. The agency concurred and the Senate adopted.
Move to concur.
Second.
On page 114 is another request for committee narrative requesting a reconciliation of the Child Support Reinvestment Fund. The agency concurred and the Senate adopted.
Move to concur.
Second.
And then on page 115, item 4 is a recommendation to reduce the fiscal 2026 deficiency for call center services. The agency disagrees and the Senate adopted.
Move to reject.
Second.
In the Family Investment Administration, beginning on page 116, DLS recommended reducing or deleting the funds related to the SNAP Nutrition Education Program because it was repealed, but the funds remained in the budget. The agency concurred, the Senate adopted.
Move to concur.
Second.
Recommendation 2 was to delete funds for departmental legislation that was withdrawn. The agency concurred, however, supplemental number 1 already withdrew these funds, so the Senate rejected, and you would want to concur because the funds aren't available.
Move to concur because the funds aren't available.
Second.
Recommendation 3 is to reduce the appropriation for SNAP to better align with the benefit levels. The agency disagreed, the Senate adopted.
Move to concur.
Second.
Recommendation 4 on page 117 reduces the federal fund appropriation due to reflect the decrease in the federal share of the SNAP administrative match. The general funds were added, but the federal funds were not taken out. The agency concurred, and the Senate adopted.
Move to concur.
Second.
On page 118, recommendation 5 is the annual language that restricts the funds in the assistance payments program to that purpose. The agency concurred, and the first house adopted.
Move to concur.
Second.
Recommendation 6 that begins on page 119 and continues on to the next page is the language that restricts funds for the quarterly reports on application processing times, denial rates, and case closures. The agency concurred, and the first house adopted.
Move to concur.
Second.
Turning to page 121, recommendation 7 restricts funds pending a report on the calculation of the Maryland minimum living level and the resulting TCA benefit levels, and requests the date that the benefit changes would go into effect and a reason if it's beyond October 1st. The agency concurred in part, requesting a different due date. The first house adopted.
Move to concur.
Second.
Recommendation 8 on page 123 is narrative requesting a report on participation in the Sunbucks program and also expressing intent regarding the budgeting of administrative funds. The agency concurred in part, preferring a January 1 due date instead of the December 1 due date that was in the recommendation. The Senate modified to adopt a December 15th due date.
Move to concur.
Second.
Recommendation 9 begins on page 126 and continues to the next page. This wasn't a recommendation, this was a first house additional action. This was restricts funds, $100,000 pending a report on the outcome of appeals on the SNAP payment error rate penalties that are outstanding, requests information on any new penalty issued, and then a detailed plan and timeline for bringing down the payment error rate.
Move to modify to increase the restriction to $250,000.
Second.
Item 10 on page 128. This is a DLS recommendation to withdraw $59.3 million of fiscal 26 appropriation from the fiscal responsibility fund that was for the use for SNAP during the shutdown that were unneeded for that purpose. The agency concurred, and the first house adopted.
Move to concur.
Second.
And on page 129, recommendation 11 is was a recommendation to reduce the federal fund portion of a deficiency appropriation because the agency had indicated that it was an overstated federal fund amount. However, they disagreed, and the Senate rejected.
Move to concur.
Second.
And that concludes the Family Investment Administration.
Oops, sorry.
On page 131, in the Office of Home Energy Programs, the first recommendation is to reduce general funds for personnel expenses. The agency concurred, and the Senate adopted.
Move to concur.
Second.
The second recommendation on that same page adds language restricting funds pending the submission of a report on application processing times and denial rates. And the agency concurred in part and the Senate adopted.
Move to concur.
Second.
On page 132, recommendation 3 was to adopt a narrative requesting MFR data on energy assistance participation rates. The agency concurred and the Senate adopted.
Move to concur.
Second.
Turning to page 134, this starts the Department of Housing and Community Development. The first DLS recommendation was to reduce funds for the Montgomery County Facade Refresh Program, which could be potentially replaced with general obligation bonds. The agency concurred in part. They were okay with bonds, but requested maintaining the full funding, and the Senate rejected this.
Move to concur with the Senate.
Second.
Items 2 and 3 on pages 134 onto page 135 are adding technical language to conform with the relevant BRFA provision, and the agency concurred, and the Senate adopted both 2 and 3.
Move to concur
Second.
and concur on 3 also.
Second.
On page 135, the Senate took an additional action, item 4, to add language expressing the intent that community action agencies be defined as emergency providers.
Move to concur.
Second.
On the bottom of page 135, onto page 136, item 5 was an additional action taken by the Senate to restrict funds pending the receipt of a report on addressing vacant properties in Baltimore City.
Move to concur.
Second.
And then item 6 on page 137, the Senate adopted narrative requesting a report on housing industry apprenticeships.
Move to concur.
Second.
Finally, on page 138, the Senate adopted narrative requesting a report on housing production opportunities at rail mass transit stops.
Move to concur.
Second.
That's all I have.
That's it? Oh my goodness. Well, we went through all of the additional pages and the packet. So I want to take a moment to, well, let me go ahead and do this. Move the full HSS committee report.
Second.
All in favor say aye.
Aye.
Any opposed say no. The ayes have it. The HSS subcommittee report on the FY27 budget has been moved. I want to take a moment, though, I know we do this formally on our Friday full committee report, but I just want to take a moment to thank every single one of the analysts that have been crucial to helping us understand every component of the FY27 budget, and all of the advocates who we have met, and all of the agencies who we have met. And especially want to take a moment to thank Victoria for her work in this new role to this subcommittee, right? And managing the whole HSS portfolio in addition to some of the most complex portions of our budget. And of course, a big thank you to Joe Gupperlet, our subcommittee counsel, who is a delight to work with. Thank you very much. That concludes our budget committee hearing today. Thank you.